All right, but the ethical and legal concepts in nursing is actually under the safe and effective care environment. So if you have taken the NCLEX already, or if it's your first time, majority or the bulk of the questions are under your safe and ethical or safe and effective care environment. So under here would be like your concepts about negligence and malpractice. What else? Establishing priorities. I think it would be discussed in a separate topic, the safety and infection control. So please attend those classes. And for today's class, because again, it's about 16% in your exam that is comprised of safe and effective care environment. So we wanted to be sure that in your NCLEX exam, you'd be able to answer questions, particularly first, let's talk about the ethical and legal concepts in nursing. All right, so before that, I just wanted to let you know if any one of you are writing, I'll be sending this together with your psychiatric nursing topics. Okay, so please do expect a copy of this one. Okay, so are you guys ready to learn the ethical and legal concepts in nursing? Are you all ready?
Yes.
Yes.
Yes, okay. So others find it boring, this topic is boring, but I beg to disagree because imagine yourself, nurses, that you are already a licensed nurse, you are already practicing, you passed the NCLEX, you passed the OSCE, and you're now ready. Okay, so imagine yourself in this situation, complying about this ethical and legal principles. These are our guide on how to become a professional and ethical nurse in the future. Okay, so imagine yourself that you are already a nurse working as a medical surgical nursing or a psychiatric nursing or an oncology nurse or whichever field of nursing you wish to pursue a career from. All right, so first let's identify those ethical principles. And these, by the way, are the autonomy, beneficence, confidentiality, justice, fidelity, non maleficence, and veracity. Now, we do have a lot. We do have a lot of ethical principles, but we will be just talking about those that are commonly asked in the NCLEX exam and that we as a nurse can definitely relate to, okay, once we go into practice. All right, so when we say autonomy, this is actually the individual's self-determination. So it is the determination or it is the will of the client, either, all right, either the client will, let's say, during an informed consent, okay, during a consultation, the doctor recommended that the client should undergo a surgery. So from that moment on, okay, we have to encourage or we have to let the client, okay, decide from themselves. Either they wish to push through with the surgery or they wish to refuse the surgery. However, our role here as a nurse, all right, our role here as a nurse is that when they are exercising their sense of autonomy, we have to at least guide them. Okay, we have to be an advocate for this nurse, for these clients. In the event that the client refused to undergo a surgery, although we respect, okay, their decision because we are letting them exercise the ethical principles of autonomy. Again, this is an individual's self-determination. But in the event that the client refuse, all right, the surgery, so our role here is to make well or to promote wellness for the client. So we have to act as an advocate to the client, and we simply have to remind them that, okay, the doctor simply recommended you a surgery. It's because this and that, so on and so forth. All right. So again, autonomy. Example here, the client chooses to accept or reject recommended treatment plan. in the event that the client rejects the treatment plan. So we have to act as an advocate, nurses. All right, we have to act as an advocate that the reason why we're doing this, okay, is for the wellness or for the benefit of the client. Ethical principle of your autonomy. Your beneficence, on the other hand, as defined here, this is the duty to do good to others. All right. Action should promote the patient's welfare. Again, beneficence, the duty to do good to others. So these are our actions, nurses, that promotes welfare of the client. So let's say, for example, a nurse protects and defends the rights of a person with mental health disability. Another example. So the client had been in the room for a week already and has not been out. So you wanted to be sure that the client will have a proper ventilation. The client would have a good, exposure to sun, early morning sun. So you will act now, or you are guided with your ethical principles of beneficence. If you would take out the client, put the client in a wheelchair, and have the client or take the client into the lanai or into the porch or outside or a mini garden in the facility. All right, that is your beneficence. Your obligation, nurses, to promote welfare of the client. All right, non-maleficence, on the other hand, okay, non-maleficence, it is our duty. Okay, we sworn upon oath taking that our role, or once we go into practice as a nurse, okay, it is our duty, our obligation to do no harm to another. All right, so example of your non-maleficence would be a nurse does not administer an ordered medication when a potential negative consequences is suspected, or that could be a possibilities of allergy or any adverse reaction. All right, so non-maleficence. Mal is actually bad. Okay, so somewhat to a similar characteristics of a Disney character of seven, no, Snow White and the Seven Dwarf. The stepmom, or I think, yeah, it was the stepmom of Snow White, who is Maleficent, right? So I think of Maleficent. Maleficent is a bad in character, but as a nurse, okay, we are opposite of not of maleficent. Okay, none means no, no bad. All right, no bad, non-maleficence. Again, non-maleficence, as defined, the obligation to do no harm to other. Okay, another thing, if the doctor ordered a medication that is somehow, that is contraindicated to a client's condition. So this is something that you would have to phone in, or you have to clarify to the doctor that, hey, doctor, if this, I will give this medication to the client, blah, 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 so on and so forth. Okay, our obligation to do no harm. Another, okay, ethical principle, fairness and equality in treatment. Any idea which ethical principle is this? Fairness and equality in treatment.
Justice, justice.
Justice, very good. Okay, so justice, so fairness and equality, regardless of the client's pay status, regardless of the client's race, regardless of the client's healthcare insurance, you have to treat them equally. All right, so each of these clients should receive the same level of care, regardless of the race, religion, prayer status. Okay, but take note, nurses, fairness and equality does not always apply in the emergency setting. Okay, because in your emergency setting, this is the time that we do triaging, right? So this is the time that we do triaging to our clients, especially, okay, whom do we need to care urgently? Okay, whom do we need to care? Okay, those would be in the emergency situation clients. All right, next would be your urgent and non-urgent client. All right. However, again, take note, justice, when we say justice, this is fairness and equality in treatment. But justice does not always apply once you are working as a emergency nurse or as an emergency nurse. Why? Because this is the time that we do triaging. Okay. So again, as example here, all of the clients, all right, let's say in the medical surgical ward already, so all of the clients should receive the same level of care regardless of this race, religion, prayer status, or the pay status or the financial status of the client. Because sometimes, as a nurse, we tend to get close to those clients that, oh, okay, this one is a celebrity, I should give this, super or beyond, or like, a superhero care to this client, so on and so forth, because this client is celebrity or this client is a VIP. All right, but it should not be that way. Okay, principles of justice, fairness, and equality. Now, next is the duty to do what one has promised. Okay, the duty to do what one has promised, and this is your ethical principle of your fidelity. Most especially if you're working as a what? If you are working as a psychiatric nurse. Now, during your orientation phase, okay, the first meeting of the client, remember in your orientation phase, this is the time that we establish uh, rapport with the client. This is the time that we establish, okay, trust with the client. This is the time that we establish the meeting or the schedule of meetings with the client. So when we say in the orientation phase, okay, I am your nurse, I'll be meeting you from 8 in the morning till 12 noon, all right, Monday to Friday. So when you said that you'll be meeting with the client from 8 in the morning till 12 noon, be sure that you have to do what you have promised to the client, okay? The ethical principle of your fidelity, all right? The nurse gets back to the scheduled meeting with the client on time. Now, professor, what if you were not able to get back to the client on time? At least you have to send another nurse to inform the client that you are still attending a client in room A or room B, and you see the client that you're supposed to meet on time in 30 minutes. All right. Fidelity, the duty to do what one has promised. Now, veracity, the obligation to tell the truth. All right. Veracity, the obligation to tell the truth. The nurse explains the potential discomfort of a procedure when the client asks the nurse. All right. So, this veracity applies to any diagnostic procedures that we have to assist the client, especially example. All right, example, a 40-year-old client, it's her first time to undergo mammography, and then the client, okay, is somehow looking anxious because she doesn't know what are to expect during the mammography. So for a fact that mammography can cause slight discomfort to the client. The client may have pain, a little pain, so you have to inform the client that, okay, you may experience slight discomfort. Again, it is our duty to tell the truth. All right. Ethical principle of your veracity. Another thing, the client is about to undergo your EMG, right? Your electromyography. So going back, what is your EMG? These are electronically charged needles inserted in the muscle of the client to detect, okay, the muscle activity. So knowing that these are needles, charged needles, so you have to again set their expectation. So patient X, so I'll be inserting, or the doctor will be doing this, blah blah blah, so on and so forth. You may experience slight comfort, or after the procedure you may experience this, so on and so forth. All right, the obligation to tell the truth. And last but not the least, we have your confidentiality. All right, privacy of information, including the medical record, or protecting the personal health information of the client. All right, clients' medical records are secured so they can be accessed only by the person who needs to see them. So imagine this, nurses. All right, it's not only these clients that we have to protect the information, right? Imagine if it's you, okay, on or in the patient of, or in the situation of the client, and here you are, another nurse who is attending to you. When somebody called in, the insurance called in, hi, I just wanted to confirm if you know Marjorie is in there. I know she was admitted, and then here you are. You know, you confirmed yes, she's actually here. She's in room 21B, and yeah. So I'm just wondering what is her the last or her insurance number, so on and so forth. Those medical records, personal health information should not be disclosed to anyone, most especially, all right, that is not related to the client. Okay, some of these are health insurance company that would call the facility asking the whereabout of the client. All right. What else? It could be personal health information such as your date of birth. All right, the address of the client. All right, or medical records, the laboratory result of the client. Even though that, let's say, for example, your mother is admitted in ward A, all right, and you are working as a nurse in that same hospital, but you're concerned about, you know, the progress of your mother. So here you are, even though that you are working as an operating room nurse, you went to ward A. You asked the nurse, can I see the medical or the chart of my mother? I'm just concerned. Again, it's not it's against the will to share any medical record of the client. Who are those only allowed to see the chart? Okay, the nurse attending to the mother in the given scenario and the doctor. But if the client authorized certain person, all right, authorize a certain person that if this person would call, if this person would ask about my date of birth, if this person would ask about my insurance, that's the time, that's the only time that you're allowed to release those information. But overall, nurses, we do not, or as much as possible, it is our obligation, it is our duty to protect the personal health information or any private information of the clients, okay, most especially the medical record. All right, are we clear? And confidentiality, this is also in compliance to your HIPAA. Are you familiar with the HIPAA? I'm not even sure if it's in Australia, it's practice, the HIPAA, Health Insurance Portability and Accountability Act. Have you heard about that? Do you have that in Australia? Anyone would like to share? Yes, Navjot, would you like to share?
No, ma'am.
No, okay. All right. So anyhow, we'll discuss later on, okay, your other health, um, other, um, or laws, okay, applicable to us nurses, okay. So overall, before we proceed with the practice question, any questions? Any questions, nurses? None so far? Okay, so let's try to answer this one. The client was diagnosed with terminal cancer. His family asked his physician to explain to him his illness on their behalf. What principle guides this situation? All right, is it autonomy? Is it number two, veracity? Number three, beneficence? Or number four, the principle of double effect? The client was diagnosed with terminal cancer.
Option two, ma'am. Veracity.
Okay. Okay, veracity. Why veracity? Why?
Obligation to tell the truth.
The obligation to tell the truth. Okay, basically go back to the question. Okay, his family asked the physician to explain to him his illness on their behalf. Okay, so again, veracity. Okay, veracity guides the practice of truth. All right. So on the other hand, if the client, all right, if the client agrees to the recommended treatment plan in this question, so that would be your autonomy. All right. Again, but answer for this would be your veracity. Another question. You are one of the vaccinators in the measles rubella campaign. One mother hesitated since she verbalized that it would hurt her son as well, hurt her son. As a well versed nurse about ethical consideration, You explain to the mother that it might cause discomfort, but it will protect her son from acquiring the said disease. What principle did you utilize? Okay, you are one of the vaccinators in the Rubella campaign. One mother hesitated since she verbalized that it would hurt her son. Um, as a well versed nurse about ethical consideration, you explain to the mother that it might cause discomfort, but it will protect her son from acquiring the said disease. What principle did you utilize? Is it number one, non-maleficence, number two, justice, number three, beneficence, or number four, autonomy?
3.
Number three, very good. Okay, that would be your beneficence. Okay, so basically here, the nurse is promoting or focus on promoting the good, right? Or the best interest of the client. All right, so are we clear? Clear so far, nurses?
Yes, ma'am.
Okay, so let's talk about the legal liability. All right, legal liability. Now, once we get our license, once we get, or we're completely, or we're now ready to work, okay, in the facility or in the hospital. Now, always bear in mind, that nurses, that all of our actions, every nursing actions, we are held responsible. Okay, we are all held liable, most especially for the harm, okay, that we have caused to the client. All right, so excuse me. So first, let's talk about, okay, a civil wrong, which is tort. All right, tort is a civil wrong other than a breach in contract in which, okay, the law allows, okay, the injured person to seek damage from the person who caused the injury. All right, so basically, it is a law, all right, that has been passed on not just in the United States, not just in Canada, but as well as in Australia. That one, if one is somehow harassed, or somebody in the event of care, this person had an injury. So this actually, the tort law, all right, gives that individual who has been hurt to defend or to seek, okay, um legal damage or legal liabilities from the person who caused the damage. All right, so tort, this is a civil wrong other than a breach in contract. So this would give you, now if you are, for example, let's say, you are a client who had been exposed to a client who has a radiation, okay, internal radiation, and you're not aware that that client actually has a radiation, and it so happened that you were roomed into that client. So in that case, so something happened to you because it compromises your health. This would actually allow you to seek, okay, any liabilities. All right, so we actually have two kinds of tort. We have the intentional tort and the unintentional tort. All right, intentionally, these are intended. Okay, unintentional tort, you are not aware of these actions. All right, so what are the examples of your intentional tort? We have your fraud, we have your defamation, we have your assault and battery, we have false imprisonment, and we have invasion of privacy. Unintentional tort, we have your malpractice and your negligence. All right, malpractice and negligence, most especially your negligence, these are NCLEX hot topic. All right, but first, let's recall the concepts of your intentional tort. All right, intentional tort. So we have your fraud. So fraud, as defined here, results from deliberate deception, okay, intended to produce unlawful gains. All right, deliberate deception. You are trying to deceive, okay, a person, or let's say it could be a hospital that you applied because you wanted to show to them that you are an experienced nurse, and here you are, All right, what you presented, okay, it's not a real document. All right, so it intentionally, right? Intentionally, you deceive an institution. All right. Another would be your defamation. When we say defamation, this is a false communication or careless disregard for the truth that causes damage to someone else's reputation. Now, defamation of character can be in a form of your, okay, either spreading false news, all right, or it can be in writing. We have, or it can be in a form of your libel. All right, so if it's in the form of writing, that is what we termed your libel. All right, libel. Okay, as if, let's say for example, you have a colleague that you do not get along and you really hate that colleague of yours, and here you are, being irritated, being annoyed with that colleague. You now go through your social media status, type in your anger, your annoyance, okay, to that colleague of yours, this blah 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 blah, so on and so forth and so on and so forth. Okay, that is in a form of writing. Okay, libel. And with that method that you write down, okay, whatever you wrote into that status or in your social media account, it damages the person's reputation. All right, defamation of character through writing, that would be your libel. All right, now we also have another, would be your slander. Slander, this is damaging someone else's reputation by simply talking against that person. Let's say you talk about your colleague that you do not like in a cafeteria or in an elevator full of other staff that works in that facility, and it so happened that these other people hear you, and in public places such as cafeteria, your colleagues overheard you about talking this your colleague that you do not like the most. All right, damaging someone else's reputation through speaking would be your slander. All right, so again, libel in a form of, just think of letter. Okay, when you write down letter, you simply write it, right? Damaging someone else's reputation through writing or through letter. Okay, that would be your libel. Slander, that would be through speaking. Okay, false communication or careless disregard for the truth that causes damage to someone else's reputation. Okay, another, we have your, okay, another intentional tort, we have your assault and battery. So assault and battery occurs when a person puts another person in a fear of harmful or offensive conduct. All right, excuse me. Sorry about that. Now, assault and battery, this occurs when a person puts another person in fear of harmful or offensive conduct. So simply, your assault, this is more like threatening the client. If you will not eat, I will hit you. If you will not drink your medication, I will hit you. Okay, threatening the client. Battery, on the other hand, this is now the time that you carry out the threat. All right, so this is the time when hitting comes in, or let's say giving a shot to the client, or to a client who refuses the shot. All right, so that is your battery or your assault and battery. Again, assault, threatening the client. Battery, carrying out the threat to the client. All right, so another would be false imprisonment. False imprisonment occurs, okay, false imprisonment occurs when the client is not allowed to leave the healthcare facility when there is no legal justification to detain the client. So if the client verbalizes that I wanted to go home, I wanted to, you know, if the client, if you still detain the client, even though that the client signed a an agreement or signed the home against medical advice, so and here you're still detaining the client, that is already now considered false imprisonment. All right. Now, another form of your false imprisonment could be, all right, with the use of your restraining device without a, okay, appropriate clinical need. All right, your restraints. So restraints is, it's actually, very very concerning, especially if there's no, appropriate need as to why you're gonna restrain this client. So if you will use a restraint, if you have requested a restraint, or more so if you did not, okay, did not ask for any orders from the doctor, it's because you're annoyed with this client, it's because this client is non-compliant, this client has been manipulative, this client had been disruptive, so you now restrain the client on your own, all right, without asking for a doctor's order. So this is now can be in a form of your false imprisonment as well. All right, false imprisonment. Another would be in a form of chemical. Okay, so chemical form, this could be giving the client, okay, of high dose narcotic drugs or your opioids, all right, or tranquilizers, all right. So that can also be a form of your false imprisonment. Again, false imprisonment occurs when the client is not allowed to leave the healthcare facility when there is no legal justification to detain the client. Another, okay, example, or your another kind of your intentional tort would be your invasion of privacy. Invasion of privacy, this is a violation of confidentiality, including, okay, including the private, okay, or intruding on private client or family matters and sharing information with unauthorized person. All right, invasion of privacy, um, violation of confidentiality. Now, when a client is admitted to the emergency room, right? So to provide privacy to the client, we also have to drape, right? We have to drape these curtains. And well, you are doing your assessment, but in the event that you did not drape, that can also be considered as already an invasion of privacy. All right. So giving those healthcare information, again, invasion of privacy. All right. So what else? Um, Somebody called in asking for the patient, asking for the information of the client, that is already invasion of privacy. Okay, so again, invasion of your privacy and your ethical principle confidentiality goes hand in hand. It is our duty, it is our obligation, nurses, okay, to protect these personal health information of the client. All right, are we clear? Intentional tort. Now, in your unintentional tort, we have two kinds, right? The malpractice and your negligence. So when we say malpractice, okay, this is actually any or unethical conduct, okay, a conduct or our duties, our actions as a nurse that is unethical, okay, or by the holder of profession, that is us nurses, that the cause of injury, take note, there is an injury, is the failure to perform the duty. Okay, so basically, unintentionally, it was not your intention to cause harm to the client or to cause duty to the client, but okay, you were able to, or the client, let's say for example, suffered from fall. All right. So malpractice, this is okay, an unethical conduct by the holder profession that the cause of injury is the failure to perform the duty. This is a standard of care that falls below, okay, our scope and practices. Another would be, okay, a form of your malpractice, um, You are just a recently graduate nurse, all right? You are, okay, I see another somebody navigating. Verana. Okay, Arcana. Was it Arcana? Just give me 1 second here. Okay. So again, that is your another example of your malpractice. You are a recently graduate nurse, and here you are. You know, your neighbor proudly ask you, would you recommend, or what would be your recommendation? I'm having a sore throat for 3 days already, and here you are, feeling like a pro, you know, recommended a medication. You give a what? Prescription. Okay, basically, that is not within your scope of practice to give prescription. That is now considered malpractice. Another would be, all right, another would be um, still, a recent graduate nurse, like you do not hold a profession or a license yet, but here you are, you're very confident suturing the wound of the client. All right. So, and that when you sutured, you did not practice, sterile technique. And then here comes infection happen, injury happen, harm happen. All right. That is malpractice. It is not within your scope of practice, nurses, to do tooth extraction, but here you are, perform tooth extraction. Malpractice. All right. Your negligence, on the other hand, okay, still, this is a conduct, an action. All right. Our scope of practices as a nurse that falls beyond the standard of care. Now, unfortunately, okay, because that, it's not within the standard, it's not within the scope of practice, an injury happened. All right. Now, this is though unintentional, but take note, nurses, you fail to take any precautions as expected or the legal standard of care. You did not simply abide, you did not simply follow, all right, the legal standard of care. You know for a fact that, for an elderly, let's say a malnourished client had been admitted, and it's the client's, weight is like 80 pounds, so thin, like skin and bone, all right. Now, you did not turn the client every 2 hours. So what happened? When the client was admitted, there was no pressure ulcers. And in the client's stay, the client already developed stage one, okay, pressure ulcer. It progresses to stage two, stage three, and to the event that the undermining already resulted. Okay, that is a form of your negligence. All right, a conduct that falls below the standard of care. All right, results from injury that is unintentional due to the failure to take the usual precaution expected or the legal standard of care. Another would be, okay, a client has a seizure precaution, okay, but here you are, you did not put the client's bed in a low or safe position. All right, you did not raise the side rails. All right, and the client all of a sudden had a seizure, fell down off from the bed, and hit the head, and then injury happened. All right, that is already negligence. Okay, you gave the wrong medication to the client. That is already negligence. All right, you offered you offered a meal to the client who is about to have a surgery, and then the client, okay, while on the surgery table, suffered from aspiration. All right, negligence. Okay, now this can be taken against the nurses. Okay, be mindful that again, in every actions that we put into, or in every actions that we give to our client, we're always held liable. Okay, now this can be also a grounds for your license to be revoked. Just like the recent nurse, okay, a recent nurse whose license has been revoked because although it was not her intention to give a medication, but she's over, she works beyond her hour already, and she just floated to that unit. And when she ordered a medication, upon reading the chart of the client or reading the order of the doctor, what she typed in the computer was a different drug. And she was so exhausted, she did not double check the drug. She just gave it to the client, and it so happened that the drug that she gave to the client caused the client's death. Okay, so if you are familiar with the story of Redonda, so Redonda was, I think, from you know, in the state. She's in one of the, I forgot specifically which state in the United States, but her story actually caused an alarm to the healthcare industry, most especially in the hospitals in the United States, because she was overworked. They were understaffed. She was about to go home, but because there is a need for a nurse to go on duty, and it so happened that she did not, or she dispensed a wrong drug, and the dispensed drug was the one that caused the death of the client that she it wasn't even under her care. Okay, so that actually her license was revoked. Okay, so that is a very like a heavy grounds, okay, for your negligence. All right, now again, these can be a grounds for your license to be revoked. Now proven, okay, proven with these four proofs of liability. All right, so what are these? A professional OA duty. You were on duty at that shift the moment that injury happened. All right, a professional breach a duty. Okay, harm was done. All right, and the injury was the cause of the harm. All right, now any event that all of these, okay, are proven in the court, okay, most especially the injury was the cause of the harm, then again this can be a ground for what? Okay, a a license to be revoked. All right. We've worked so hard for our license. We've studied 4 years in nursing. And here you are, you're not being mindful. You've paid so much, or you've invested so much time, effort, money to prepare for your NCLEX, all right, to prepare for your OSCE. And here you are, not being mindful with your actions, not being cautious with your actions, and then harm happened, or injury happened to the client, or worst, okay, death happened to the client. Okay, that can be again a heavy, or a very good grounds for your license to be revoked, or your negligence. Take note, negligence, this is under your unintentional tort. What do you mean by tort? Okay, this is a civil wrong that allows the individual, particularly the injured individual, to seek a legal liability, or to seek justice of any harm that was done to them. Okay. Now, in the event that there are some cases, nurses, that does not go through these proceeding already, does not need to prove, like, were you on duty at that time, or a professional breach of duty, or a harm was done, or the injury was the cause of the harm, there is what we call your res ipsa liciter. Okay, res ipsa liciter. Are you familiar with this one? Are you familiar with your res ipsa liciter? No, okay. Basically, your res ipsa liciter, this is, termed as the thing speaks for itself. The thing speaks for itself. Best example for this one, okay, res ipsa liciter. Let's say, for example, the client agreed to a surgery, all right, because again, you act as an advocate. You recommend to the client that it's for your welfare, it's for your wellness, it's for the benefit of you, okay. And the client now had undergone the surgery. She was already in the surgery table. Okay, the surgery was successful. But here you are, instead, like 2 days or 3 days after the surgery, 5 days after the surgery, the client is already experiencing high grade fever. Okay, the client is already feeling ill. The client is not like, being well, because as encouraged, or as what you advise to the client, that it's for the good, it's for your good. But the client's condition after the surgery is kind of somehow deteriorating. Okay, it's because for the reason that, okay, there is a surgical gauze that is left inside the client's body while the client, okay, agreed to the surgery to be performed. Okay, rep ipsa liciter. The thing speaks for itself. That is already a strong evidence that the nurse who is on duty at the time, particularly the circulating nurse, okay, committed negligence. The circulating nurse failed to do recount of the medical surgical gauze that has been used in the entire surgery. Okay, let's say, for example, the client had undergone explore laparotomy, okay, or even as simple as your cesarean section. Okay, a few days after the client's surgery, few days after, or like a week after, 2 weeks after the client's cesarean section, the client's condition is somehow deteriorating. The client is having high grade fever, or in short, the client is already having sepsis. Okay, because there is already a foreign object left inside the body of the client. Right, the thing speaks for itself. Rep ipsa liciter. All right. Now, here in the Philippines, most especially a government hospital, I just wanted to cite you an example. It did happen here. Okay. A circulating nurse failed to do recount of a surgical gauze that had been used in the surgery. Now, a week after the surgery, the client is not feeling well. The client had fever, high grade fever, and upon checking, the client had an increasing WBC. Okay, now the client had undergone X-ray, and then there the doctor found the gauze, the surgical gauze. Okay, rep ipsa res ipsa liciter. The thing speaks for itself. If the client would ask, okay, again, tort, you know, that can be a really a good ground for your, okay, negligence. All right. Are we clear with your negligence and malpractice?
Yes.
Okay. Are we clear? Okay. Let's have a drill. Okay. Um, a harmful object the near or left near the patient who has a suicidal ideation.
Negligence.
Harmful negligence. Very good. Okay, negligence. All right. The nurse performs tooth extraction to the client suffering of toothache. That is your
Malpractice.
practice. Very good. Okay.
Malpractice.
The graduate nurse prescribes medication to the patient.
Malpractice.
Malpractice.
Very good. Okay. Failure to observe and take appropriate action about the untoward effects, okay, observed in the client.
Negligence.
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 Very good. Okay, not following the 5 rights and
Negligence.
causing harm to the client.
Negligence.
Okay, not
Negligence.
following the 5 rights and causing harm to the client. Negligence. Okay,
Yeah.
performing sutures to the client's open wound.
Malpractice.
Malpractice.
Very good. All right, so let's try to answer this one. All right. So the client is not compliant to his treatment ECT and does not take his medication due to his paranoid personality. His nurse was so hopeless that she threatened the client not to give him his regular meals if he will not submit himself to his therapy and treatments. What kind of malpractice was committed in this situation?
Assault.
Okay. Basically, what is your
Assault.
keyword here? What is your keyword?
Assault. It's a threat.
Threaten. Assault.
The threat,
Threaten.
right? Okay. Threatened. Threatened the client not to give him his regular meals, and that is your assault. All right. Now, another law that I'll be talking about that is applicable to to us nurses would be the Good Samaritan law. So basically, this is a law that encourages all healthcare professional to assist in emergency situation. And when you assist in emergency situation, okay, given that you are a healthcare professional, this would somehow limit your liability and have, okay, or you will have a legal immunity for a person in an emergency, okay, provided that they give reasonable care. Because sometimes I think it's also applicable in Australia, you know, when these professionals or nurses or anyone in the medical field would go home, they are just in their civilians, right? Because all of a sudden, who knows, on their way home, a bystander was calling for a help because there was this person who collapsed, okay, and that needs a medical attention. And sometimes, you know, instead of doing good to the client, okay, something harmed happened, and the family member would try to sue you, okay, because if you have not attended or you have not responded, then my um that person, or let's say a family member, would still be alive, but you know, you have been doing a CPR thrashing so hard that it caused to have, you know, a break in the rib cage. Those common scenarios that would somehow, you know, um limit or not, you know, most of the nurses or medical professional would not attend to in a, like in emergency situation, because you know, to them something might, or it could be, you know, they would have legal liabilities. Okay, but take note, the Good Samaritan law, okay, the Good Samaritan law, this is a law that encourages, okay, that healthcare individual to participate in an emergency situation, given that you give a reasonable care, would offer you a legal immunity. All right. So, oh, this person, you cannot blame this nurse. It's because blah, 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 so on and so forth. Basically, it offers us protection, nurses. Because sometimes, you know, there are some family members who would really take advantage, that they would try to sue this certain hospital because in your scrub suit there is, let's say, like a hospital that where you work, and then all of a sudden, you know, somebody took a picture of you while you were doing CPR. Now it shows the logo of your the hospital from where you worked in, and then while you're doing a CPR, when the client recovered, the client said is now having, you know, I'm having difficulty breathing, I'm having chest pain all the time. It's because the nurse did this, so on and so forth. So I would now like to seek, okay, legal, or you know, seek liabilities. But again, Good Samaritan law would give you protection, it would give you immunity. In fact, all of nurses are again encouraged to participate in an emergency situation. Okay, another would be your Health Insurance Portability and Accountability Act, or your HIPAA. So this basically describes how personal health information may be used and how the client, okay, can obtain access to the information. So again, it can be obtained such as what? Okay, from phone call or a gossip in the cafeteria. All right. The act requires healthcare agencies, okay, to keep private health information provides information to the client about the legal responsibilities regarding privacy, and explains to the client's rights with respect to the private health information. So a breach in your HIPAA can be a form of your um, a breach in the HIPAA can be in a form that you did not close, okay, or you did not use a strong password in your electronic health record. All right, you did not, or you give out your password in the computer that contains all of the private health information of the client that you care for or attend to. Okay, now you are not allowed, or it can be a breach in HIPAA if you give these information, okay, personal health information of the client that is not within, okay, the member of the healthcare team who gives care directly to the client. All right. Um, you shared the information, okay, to your friend who is in another unit. All right. So what else? What we do not give nurses, okay, or what we do not keep, okay, information that we do not keep would be if the client has what? Communicable disease. All right. We do not keep this information, most especially to the members of the facility, or the healthcare team member. Why? Because that can be a communicable disease, could be a threat to everyone working in that facility. So to protect ourselves, okay, for us to wear mask every time when we go near into this, let's say, room of the client, okay, so we do not keep, again, conditions if the client has communicable disease. Okay, so it is right to inform, most especially other members of the healthcare team, okay, or other nurses in the unit, to inform that this client, so that we can establish precautions. Okay, we can establish precautions and not to spread the infection. All right, are we clear? Okay, are we clear, nurses?
Yes.
Another form, okay, another form of your a breach in HIPAA, okay, you took the chart of the client, okay, because that client admitted in Ward A is your idolized celebrity. So you are now intrigued about the status of your idolized celebrity who happens to be in that, okay, hospital that you worked in. That can be a breach of HIPAA. Okay, somebody called in pretending to be the husband of the client, and without any authority from the patient or to the client that, okay, give my personal health information to this client, so you give out that information, that can be a breach of HIPAA. Okay, are we clear? Clear, nurses? Let's try to answer this one. A nurse witnesses a 50-year-old woman go into cardiac arrest while traveling in a train and attempts to resuscitate her. In spite of the nurse's effort, the woman dies, and the family member file a lawsuit against the nurse. Which of the following statement about Good Samaritan law is applicable here? All right, good job. That is your number 4. Okay, the Good Samaritan law will likely protect the nurse because she acted in the woman's best interest. Okay, sorry, CG. Okay, you typed in here once more, ma'am. What do you mean by this, CG? I just happened to see the chat box. What do you mean by once more? Another explanation? Oh, the HIPAA. Okay, again, your HIPAA, this is, okay, a law that is passed that describes us nurses to somehow be the protector of these personal health information of the client and not to disclose any of this personal health information. Okay, so all right, so it can be a ways of protecting your personal health information would be not sharing this. Let's say you gossip about this patient in a cafeteria. You know, cafeteria is a public place. Okay, if you ask about, let's say, your mother admitted in that unit, you ask how's my mother, what are her lab results, blah blah blah, so on and so forth. Okay, you're not the person, you're not the nurse, okay, that gives direct care to your mother, and you simply ask another nurse. That can be a breach in HIPAA. Basically, your HIPAA, the Health Insurance Portability and Accountability Act, okay, tells you to protect the personal health information, okay, of the client. Now, there are means of these personal health information that somebody can gain access to, such as what? Not using a strong password of your electronic health record, um, not or sharing your password in the electronic health record. Okay, it could be gossiping, it could be through phone call. Okay, okay, are we clear, CG?
I have a question, ma'am.
Yes, go ahead.
Okay. So according to HIPAA, it's only about protecting personal health information, right? So
Yes.
I got a question. Like, if uh, there was a client admitted to our hospital, then somebody went to our hospital and then asked, like, I'm like neighbor of
The
this
nurse.
person, so
Uh-huh,
would you please
uh-huh.
give me information in which like room number she is she admitted in this hospital? If like, so neighbor is not the person who has right to get the personal information about the client, but that the thing that the neighbor is asking is not about her health information. It's just her location and like, in which ward she is or in which room number she is. So is it okay for us to give such like
I think it's
information to the?
best. I think it's best to ask the client. Okay, when a client is admitted, if
Yeah.
somebody would ask your whereabout, is it okay to disclose them these information? And sometimes,
Okay.
a neighbor would not ask the nurse; they would ask the family member instead,
Yeah,
right? If
but
they are unsure.
yeah, but
Okay,
in the question it was like the client was unconscious when the client arrived to the hospital.
okay. Just asking about the whereabouts. Okay, not
Okay.
the insurance, not the date of birth of the
Yeah, yeah,
client,
no,
right?
nothing, just about the whereabouts.
Yeah, you can definitely
Share the
state.
information about the whereabouts.
Okay, but it all depends on how the question is presented to you, in
Okay,
what
yeah.
situation it is presented to you. Is it a question from you world?
I believe so. I got this question when I was practicing, yeah, some time ago.
Time ago? Okay, probably I think that is you world. Okay, so
Okay,
anyhow, again, personal or HIPAA,
yeah.
personal health information, okay, should be protected of the client. Okay, personal health information of the client should be protected rather. Okay.
Okay, ma'am.
Excuse me, ma. I want to chip into what she said. I've seen a question like that. It's hello,
Yes, go
ma.
ahead.
Can you hear me? I've seen a question like that where it stated, is a nurse allowed to give are you allowed to give the, like, if someone calls and says, is Mr. Jones admitted in this hospital? Are you
Mhm.
allowed to give information that the patient is in the hospital?
Okay. Back then, because like I said, it depends on the scenario. I think uh, um what the other student said earlier, I'm the neighbor, blah blah blah, so on and so forth, or if it's totally a stranger asking for the whereabouts, yeah, I'm calling on behalf of this and that. I just wanted to confirm his presence in the hospital. Still, the nurse is not allowed to give information, okay, the whereabouts of the client, okay, or let's say you can give as long as, okay, that name of the person is on the list that the client authorized to give the information of the client's whereabouts, okay, because you would need to ask the authority of the client. All right. So it's
Okay.
very important, again, nurses, if the client would go into the facility or the client would be admitted, okay, so you would inform them just to exercise your HIPAA or just to protect your personal health information, any specific person that you allow to give your information to. Okay, it's part of the assessment. It's part of our duties and responsibilities as a nurse. All right. Are we clear? Again, it is
Yes,
our
ma'am.
duty to protect, okay, the client and the personal health information of the client. The stay of the
Yes.
client is already considered a personal health information of the client, the whereabouts of the client. Okay, so if in the option, let's say your response to that would be, sorry, I cannot give you that information. All right, that's it. Are we clear? Sorry, I'm not allowed to give that. Um, I'm not allowed to give that. I'm not allowed to give that information. I'm sorry, but I'm not in the position to give that information. Okay, clear? Clear, nurses?
Yes, ma'am.
Clear.
Okay. How about you, Amanda?
Clear.
Okay. Now on to our informed consent. Okay, informed consent. So always remember that your informed consent, nurses, it should be signed, right? If the informed consent is not signed, then we need to say whatever procedure that requires or any procedure that should be done, all right, to the client, it's not considered valid. Again, informed consent or consent should be signed, meaning to say the client agreed to that consent. All right. So things that you have to bear in mind about informed consent is that you have to consider the state, all right, and the age of the client. State, the client should be what? Conscious and mentally competent, and legally a person who is 18 years and above, okay, are the ones who are allowed to sign the consent or legally able to sign the consent. State and the age of the client, okay, those who are, again, conscious and mentally. The client is not forced in here. The client should not be under the influence of drugs or any other alcohol, okay, or um, opioids or any chemical substance, okay. It should be on the client's, exercising the autonomy. Again, at what age? Legal age would be 18 years and above. Now, question, what if the client is mentally incompetent? Then who can sign the informed consent? That would be the next of kin, all right, or guardians appointed by the court, or anyone with those durable power of attorney, all right, they can also sign the consent. Again, if mentally incompetent or let's say psychologically challenged, the client or the doctor recommended for the wellness or for the benefit of the client, the doctor ordered ECT, right? Remember, again, in your ECT, prior to your ECT, the informed consent should be signed. But in that situation wherein the client is psychologically incapacitated or mentally incompetent, who can sign? Again, the next of kin, guardians appointed by the court, or those with durable power of attorney may sign the consent. All right. Again, it should not be forced. All right. And emancipated minors, take note. These are minors 17 years below. Okay. These are the minors who can sign the informed consent. All right. These are the minors who can sign the informed consent. All right. And I will give to you a list later on. Who are these emancipated minors? Okay, that can sign the consent. 17 years and below. All right. Now, who is the one that explains the procedure? That would be the doctor. Initially the doctors are the ones who explains the procedure, who tells the prognosis, the complications or alternatives and risk that may arise during the procedure. So what is our role as a nurse here? We are just a what? Witness. Witness that the doctor explained the procedure. Okay, the doctors mentioned about the prognosis, okay, the complication or possible complication, and that our role as a witness, the nurse or the client fully understood the doctor, okay, and signed that witness that it is the client who really signed the consent. Okay, are we clear? Or it could be the guardians appointed, the durable power of attorney, or the next of kin. So signed, the informed consent should be signed. So what are those cases that requires an informed consent if needed? What are those cases or scenarios that requires an informed consent that is needed? Any example? What are
Surgery.
Invasive
those?
procedure.
Surgery.
Invasive
Invasive
procedure.
procedure. Very
Surgery.
good. Okay. Surgery or any procedures done at the operating room. Any surgeries or procedure done at the operating room. Okay. Even, starting an IV, initiating an IV, invasive procedure, you have to secure an informed consent. Another would be what? Your sedation. Okay, it requires an informed consent. Or the client would be placed, or the client would drink a tranquilizer. All right, so or a client would receive an anesthesia for some event, all right, or in cases of blood transfusion, okay, you require an informed consent. All right. So again, emancipated minor at what age? Legal age, 18 years and above. However, there's always an exemption to the rule. Hence, we call this your emancipated minors. These minors are considered legally capable of signing an informed consent. So who are these emancipated minors? These are your minors that are married, okay, 17 years old minor that is married, okay, that 17-year-old married can sign the informed consent. All right, pregnant minor can sign the informed consent. In the service of the armed forces, they can sign the informed consent. And minors with court order, all right, minors with court order. All right. These are, again, emancipated minors that can sign or legally allowed or legally capable to sign the informed consent. Are we clear?
Excuse me, what of minors that seek birth control, or minors that are sick like have STDs that needs to be treated?
Okay. Again, if it's not belonging here, they are not allowed to sign the consent. Okay, a
Mm.
mother, the next of kin, okay, or anyone, let's say a durable power of attorney or a guardian, legal guardian, who can sign on behalf of that minor who seeks treatment for STD. All right. If that
Mm.
minor seeks treatment for STD and it happens that this minor is married, yes, they can. Okay. If this minor is pregnant, Yes, they can. All right. Or if this minor is in the service of the armed forces, definitely they can seek treatment for an STD. Or this minor proves that I have an order of the court that I can be on my own, blah, 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 so on and so forth. Okay. Yes, they can seek treatment as long as, again, these are the minors who are considered legally capable of signing an informed consent. Okay. A
Okay, ma.
16-year-old married, okay, definitely she can sign the informed consent. She is pregnant, 16-year-old pregnant, definitely she can sign the informed consent. All right.
Okay, ma.
I have a question, ma'am.
Yes, Amanda.
No, Richa, ma'am.
Oh,
Okay,
Richa,
now,
sorry, Richa.
okay, what if a 16-year-old girl is pregnant and comes for abortion? Is she like okay to sign her own consent, or she has to have someone with
Yes,
her?
because she is already pregnant.
Okay.
Okay, she's pregnant.
Yeah.
And even, that 16-year-old mother, okay, who is delivering a baby, she can definitely sign the consent, okay, to allow my son to undergo circumcision. Are you clear? Are we clear?
Yes. Yes.
Okay, all right. Let's try to answer this one. Okay. Informed consent is an agreement that allows a certain procedure to happen, which is true about it. Okay. Informed consent is an agreement that allows a certain procedure to happen, which is true about it. That is your which number?
Number 4.
Number 4. Good job. Okay. So a client is being given all the relevant information for her chemotherapy. Chemotherapy, again, this is invasive, right? So an 18-year-old client who refuses treatment is allowed to sign his waiver in the absence of his guardian. Very good. A mother signing at the consent form for her baby's transfusion. So answer is all of the above. Okay, all of the above. All right. Now on to our advanced directives. Okay, so advanced directives, nurses, this is actually under the Patient Self-Determination Act. We're in, okay, this is actually a law, okay, Patient Self-Determination Act. This is a law passed in the US, okay, Congress in the 1990s that all hospitals, okay, should routinely provide information on the advanced directives at the time of admission. Okay, because what is your advanced directives, why it is required, even it was made into a law, okay, that requires all healthcare professional, all nurses, most especially if you are in the emergency, okay, emergency room nurse. It's very important that upon admission of the client, you have to ask the client, do you have an advanced directives? Okay, basically your advance directives, this is actually a legal document, okay, that the client states their wish, okay, regarding the management of care of his health care whenever I am rendered incapable, okay, or incapacitated. So advanced directives, I have state there my wishes, okay, my plans, that these are the things that should do to me when I'm no longer, okay, or when I'm incapable to make decisions on my own. Okay, just base it on my advanced directive. So basically, I have everything in there. It is a legal document that states the client's wish regarding the management of care, okay, of his or healthcare provider when the patient becomes incapacitated or incapable. Let's say, for example, the client is in coma. Okay, so definitely you cannot ask any consent from the client. You cannot ask permission from the client. Okay, the client cannot exercise the sense or the ethical principle of autonomy. But however, to base your management of care in the client, you base it on the advanced directives. Because I have a list in there. I agreed, let's say, for example, okay, in that document, there is a do not resuscitate. I take on the not resuscitate, meaning to say, I agree that whenever I am incapable, whenever and I'm already, you know, in a life situation or life-threatening situation, I do not wish to be resuscitated. Okay, so do you have to accept, respect that? Yes, because this is, again, a legal document, all right, that is signed by the client, agreed by the client, all right, regarding the types of care, okay, that I wish to receive when I'm already incapable or incapacitated. All right, that is your advanced directives. We actually have two types of your advanced directives. We have healthcare proxy and your living will. Your healthcare proxy, or also known as your durable power of attorney. So I will choose, okay, I will choose somebody, a person, a proxy to make a healthcare decision on the client's behalf when I'm already incapable or when I can no longer make decisions on my own. Okay, either I will assign, okay, this person, my mother, I will assign my friend, I will assign the priest, all right, or I will assign my lawyer, all right, to make healthcare decisions on my behalf. So whatever the things that needs to be done, it is my healthcare proxy or my durable power of attorney who can sign the consent. All right, DPA, durable power of attorney. Your living will, nurses, this allows the client to state their wish to die in a certain situation and not have prolonged, okay, by using medications, artificial means, or any heroic measure. And in your living will, this is your DNR that, okay, takes place. Your DNR, okay, this is also an order should be written in the client, okay, should be written, or an order should be written if the client and the healthcare provider has made to the decision that the client's health is deteriorating and the client chooses not to undergo CPR if needed. Okay, the DNR. Now, in the event that you did, resuscitate the client, all right, but the client already agrees. I have in there, okay, this is my wish. I do not wish to be resuscitated. All right. And all of a sudden, you perform your heroic measure without checking the advanced directives. That, all right, DNR is in there, okay, ticked by the client. Can that be taken against you, nurses? If while you're doing your CPR, the client, okay, is able to recover, the client revived, okay, you have given your epinephrine 5 times, you have given the client an epinephrine shot. All right, artificial means, using medication or heroic measure. Okay, can that be taken against you, nurses?
Yes.
Yes or no?
Yes.
Yes. Okay, definitely yes. Okay, because again, you failed to check, you failed to ask. Okay, if the client has a DNR, a do not resuscitate order. All right, and again, this is an order should be written if the client and the healthcare proxy have made to the decision that the client's health is deteriorating and the client chooses not to undergo the CPR. Okay, are we clear, nurses?
Mhm.
Okay, so what are our nursing considerations? All right, nursing considerations in your advanced directives. Again, it is very important for us nurses to determine, okay, if the client has an advanced directives upon admission. So inform the clients to execute, okay, advance directives. Because again, what if during your stay here, so on and so forth, or things happen. Now, it is also our obligation, nurses, to inform, okay, the healthcare provider, and we may act as a witness, but embarrassed in some states. Okay. Now, what's also special in the advanced directives would be, okay, the organ donation. So it is in there that in my advanced directives, and not only in my advanced directives, also in my license. Same thing, I believe, okay? Same thing, I believe that in Australia, you will tick in there, or if you agree in there that you can be an organ donor, right? So organ donation is actually under the Uniform Anatomical Gift Act that allows an individual, specifically a healthy individual, okay, to donate, all right, the organs when they are already expired or died, okay? So age of eligibility, who are those 18 years old and above, can now donate, okay, their organs. So specifically, what organs can be donated? We have your heart, kidneys, okay, lungs, pancreas, bone marrow, or the cornea. All right. So again, what are the criterias? You should be free from infectious disease or any types of cancer. All right. Any types of cancer. Criteria: free of infectious disease and cancer. Now, for those who have been a recipient of the organ, all right, that has been donated, so you have to, as a nurse, you have to be cautious, or you have to watch out for the signs and symptoms of your organ rejection. Now, to prevent cases or, organ rejection, so you have to make sure that the client, okay, is able to complete, okay, these regimens, these drugs that would somehow prevent organ rejections. So these drugs are your 4Cs. So what are those? We have your cyclosporin or your sandimune. All right, we have your Cellcept, we have your corticosteroids, and your Cytoxan. Cytoxan, this is an anti-neoplastic drug, but this would somehow, okay, weaken or somehow prevents, cases, or basically you are shutting down your immune system here, shutting in a sense that, okay, you do not want your immune system to be hyperactive, okay, because there is an organ that has been transplanted in you. And sometimes, if your immune system is so strong, then definitely they would react to that organ that has been transplanted. And sometimes our own body, okay, would think that these are foreign objects, okay, and these sometimes, these organs cannot adhere to the new environment in the body of the client, who is the recipient. Okay, drugs to prevent organ rejection. So we have your cyclosporin, you have your salsa, corticosteroids, and your cytoxan. Again, healthy individual, free of cancer. So free of infectious disease. The client has no HIV. The client has no hepatitis, in all types of hepatitis. Okay, or those no malignancy, okay, or communicable disease. All right. So Janine asks, can the next of kin or family or doctor overrule the DNR? Definitely yes. If that, okay, client has a durable power of attorney. Okay, if the client has a durable power of attorney, I have assigned this person to make decisions on my behalf when I am rendered incapable. So I can now overrule if previously in my advanced directives I agreed to, okay, do not be resuscitated. I can overrule that. Okay, the durable power of attorney can definitely overrule that. Now, your durable power of attorney can overrule your organ donation. Now, in the event that you agreed, all right, to donate your organs, you have there in your um, driver's license, okay, that you wanted to be an organ donor, okay, and you agreed in your advance directives that you want to donate your organs, but since you have an assigned, all right, you have an assigned healthcare proxy or a durable power of attorney, they can definitely overrule your wish or your wishes, okay, when you are already incapable, because who makes the decision this time? It is your healthcare proxy or your durable power of attorney. All right, are we clear? Let's try to answer this one, nurses. The nurse is presenting an in-service discussion about do not resuscitate orders and advance directives. Which statement should the nurse discuss with the class? Sorry about that. Okay, it's just is it number one? Advance directives must be notarized by a notary public. Number two, the client must use an attorney to complete the advance directives. Number three, once the DNR is written, it can be used for every hospital admission. Number four, the healthcare provider must write the DNR in order in the client's chart. Number, okay, I see other answers. How about the others? Okay. The nurse is presenting an in-service discussion about do not resuscitate order and advance directives. Which statement should the nurse discuss with the class? All right. DNR, okay, if written, it is only valid in the stay of the client in the hospital. You cannot use this from any other admission. Okay.
Yeah.
So the healthcare provider must write the DNR or okay in the client's chart. Okay. So again, if it's there in the client's chart, then would you do something? Would you do any heroic measures? Yes or no? No, right? Okay.
No.
So, all right. Would you like to proceed, nurses, or would you like to have a break?
Ma'am,
Break.
break.
Uh, okay. So it's already 5:33. So let me back 10 minutes after.
8:33, 8:45, 43.
8:43. Okay. Or would you like to go 8:45? Come back 8:45.
Yes, ma'am.
Okay.
Yes, ma'am.
Very good. All right. So be back at 8:45. 8:45, right? So 5:45 my time. Okay. Be back.
Chukwu gọzikwa m kootu. This woman's alpha. Ego ole ka eche ka eji gbara Krismas? 1 million epekanụ. You saw Nandi winning 53 million last week.
All right, is everybody back? Are you all here, nurses? So moving on into our establishing priorities. So basically what we're going to talk about here is the principles of delegation. Principles of delegation, what else? Assignment and your prioritization. So questions such as your delegation, assignment, and prioritization, this is actually a high level of questions in your NCLEX. So this is something that I would tell you to at least pay attention to, nurses. Okay. So when we say delegation, this is a process of transferring. Okay. What do we transfer here? We transfer task. Okay. Or performance. Okay. Is somebody moving again? Okay. Delegation, this is a process of transferring performance of a selected nursing task in a situation to an individual who is competent to perform the specific task. Okay, so the nurse who delegates the task maintains the accountability. So basically, all right, you transfer or you delegate task that an LPN or a CNA is able to do or within their scopes of practice. All right, so delegation, this is a process of transferring performance, okay, to an individual who is competent to perform that specific task. So the nurse who delegates is the one who still, okay, is accountable to whatever harm or injuries may occur that the one who carried out the task may cause something to the client. All right. So the license that at stake here still would be the nurse, okay, because the one who gives the task or the delegator in the facility are the nurses. Okay, please bear in mind, okay, what are the 5 rights of delegation. So make sure when you delegate the task, nurses, okay, it is the right task, okay, that a member or in the healthcare team, particularly the LBN or the LVN or the LPN or the CNA can carry out. All right, what else? Okay, right circumstances, okay, or right situation. Is this nurse or CNA can carry out or do or handle unstable client? All right, or should I give or assign a CNA to care for a client who is just 1 day or 3 hours post-op? Okay, those circumstances. What else? Right person. You have to be sure that this person is able to carry out the task. Okay, right direction and communication. So you have to be direct to the point that when you tell the client, okay, or when you tell the LPN or the CNA, let's say for example the CNA, that okay, client D needs an assistance in bathing. Can you, okay, attend to the client D, help the client D, assist the client D in bathing and changing the clothes, and perhaps after, okay, assist in feeding. All right, right direction or right communication. And of course, all right, right supervision. You have to supervise that those who carry out the task that you assign to the LPN or, okay, the CNA, okay, is done correctly or appropriately. And of course, you have to evaluate. All right, give your feedback. Either, okay, CNA needs improvement next time, okay, or it needs, you have to do this, or at least give your recommendation. Or if the CNA or the LPN did a good job, then you have to, okay, commend, okay, the CNA or the LPN. Okay, so principles of delegation, again, delegate the task to the right delegatee, provide clear directions about the task to the delegatee understands. Okay, provide the delegatee with the authority to complete the task, evaluate the outcome of care that has been delegated, all right, provide a feedback to the delegatee regarding his or her performance. So take note, nurses, okay, these are the scopes and practices of nurses that the CNA cannot carry out, neither the LPN can carry out. So basically, the nurse are the ones who delegate the task, not the CNA and not the LPN. So in the unit, okay, so the nurses are the ones acting as a manager. All right, so they are the delegator. They are also the ones who are, okay, making decisions, okay, for the client. They are the decision maker. They are also the one who is only, okay, that can transfer the client or transport the client. So in transferring or transporting the client should be accompanied by a nurse, okay, not an LPN or not a CNA. All right, they are only the ones who can do most especially initial health teachings, okay, when the client is about to be discharged. So initial health teachings that the client should carry out, okay, or do, so blah 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 blah, so on and so forth, okay. Scope and practices of the nurse. What else? Discharge planning. Okay, discharge planning still under the scope of practice of the nurse. Okay, child abuse. So those who are a victim of child abuse, who cares or who is these clients will be under the direct supervision of the nurses. Unstable or new client. All right, new client, these are considered unstable. So who cares for them? Who handles for them? The nurses and the, okay, nurses only, not the CNA, not the LPN. All right, what else? Those who are immediate post-operative client. All right, you cannot assign them to your CNA or to your LPN because for the reason that those immediate post-op, they need close monitoring and they are considered unstable client. All right, those clients who would receive blood transfusion. Take note, in your blood transfusion, we need two nurses, right, to verify, to identify, okay, that prior to giving your blood transfusion, it should be checked, okay, by two nurses. What else? Chemotherapeutic drugs. Okay, so who gives the chemotherapy? Who initiates the chemotherapy? The nurses. All right, and those with central catheter. Okay, clients, those with central catheter, you cannot assign them to your LPN or to your CNA. Now, scopes and practices of your LPN or your licensed practical nurse, these LPNs are the ones who are allowed or they are the ones who give out medications. Okay, so overall in the unit, they are the technical doer. Technical doer in the sense that, okay, they are the ones who can give your what do you call this, CBG, okay, they're the ones who gives medication, all right, either oral medication, sublingual, IM, subcutaneous, intradermal, all right. They may regulate the IV but they cannot give IV push. Who can give IV push? Then that would be the nurses. Okay, your LPN are the ones who do wound care to the client, care for a client for care for traction and client with cast. All right, they can collect, okay, data, okay, collection of date or data, but okay, not initial history taking. Initially, who interviews the client when admitted? That would be the nurse. Okay, however, the LPN can follow up, all right, by collecting of data or the collection of the date. All right, what else? Intravesicular chemotherapy. Okay, intravesicular chemotherapy, such as you're into the bladder through the ureter, okay, or the urethra. What else? Okay, ostomy care. So they are the ones who are allowed to irrigate the client with ostomy early morning. Okay, they're the ones that who can change the bag of the client early morning. All right. What else? Okay, those clients that needs enteral feeding. So for NGT, it is your LPN. Okay, and those requires, okay, catheterization. Who can insert catheter? That would be your LPN. Now take note, all of these scopes and practices of an LPN, all right, the nurse can also carry out all these. However, if there is an available LPN in the unit, okay, if the client needs ostomy care, then you of course, okay, delegate the care to a client, okay, that needs ostomy care. If there is a client that needs enteral feeding, so of course you can definitely delegate this task to your LPN. Okay, but these scopes and practices of an LPN, okay, the CNA cannot, okay, carry out this. All right, so what are the scopes and practices of your UAP? So your UAP, these are your unlicensed assistive personnel. Basically, you assign the UAP to a client that requires routine of care. Okay, routine of care such as what? All right, routinary. Every day the client takes a bath. Every day, okay, you'd check the check the what do you call this, intake and output of the client. All right, turning stable clients. Okay, take note, stable clients only. All right, you do not assign unstable client to your UAP. Okay, they are the ones that do the record or the intake and output of the client. Okay, urinary dipstick, cleansing enema. What else? Skin assessment. They can do assessment. Okay, they can do assessment, but only, okay, skin assessment. And it is their duty to report immediately to the RN, most especially for any signs, okay, of sores. You already noted the UAP or the CNA working already noted, okay, soreness or redness, okay, in the buttocks of the client. So it is your duty to report immediately to the RN. What else? Okay, personal hygiene, bathing and grooming. Again, bathing and grooming only to a stable client. All right, stable client. Routine vital signs. Okay, every day checking of the vital signs and ambulation of the stable client. Again, stable client only. Feeding, stable client. All right, and CBG. Okay, CBG monitoring. So these scopes and practices, nurses of the UAP or the CNA and LVN or LPN can carry out these as well as with the nurses. Okay, nurses can carry out these tasks. All right, so the UAP, these are their, okay, scopes and practices. Now, in the event that you'll be asking your exam, okay, notify the physician, notify the healthcare provider immediately. In what circumstances would you notify? Okay, so cases such as medical emergency, okay, medical emergency that requires, okay, or airway, all right, airway compromise, that is already considered medical emergency. Those with surgical emergency, okay, there's already wound dehiscence, all right, alterations in vital signs. Remember, in your alterations in vital signs, most especially in, okay, in your shock, okay, there's already hypotension, tachycardia, tachypnea, okay, report immediately to the doctor. Neurovascular compromise, okay, neurovascular compromise, this is already your compartment syndrome. The client is already experiencing increasing pain. There is, okay, coldness or cold to touch. There is paralysis. Okay, there is paresthesia. There is pallor. All right. Toxic, okay, toxic drug or toxicity level of the drugs. Okay, such as what? Your lithium. Okay, your lithium. Alterations in the drug dosage, either underdose or overdose of the drugs. You have to notify these immediately to the doctor. So Again, when to notify the physician: medical emergency, surgical emergency, alterations in the vital signs, neurovascular compromise, toxicity level of the drugs, and alteration of the drugs. So let's try to answer this one, nurses. The plan of care for a diabetic patient includes all of these interventions. Which of the following interventions should you delegate to the UAP? Okay, is it checking to make sure that the patient's bath water is not too hot? Number two, discussing community resources for diabetic patient care. Number three, teaching the patient to perform daily foot inspection. Number four, assessing the patient's technique for drawing insulin, okay, into a syringe. Okay, so basically, that is your an easy job, a routine. Okay, that would be your number one. Checking to make sure that the patient's bath water is not too hot. Okay, discussing community resources. This is under the scope of practice of your RN. Teaching, all right, RN, all right. Assessing, that would be your RN. Okay. Your assignment, okay, the concept of your assignment in establishing priority, this is also somewhat like a transfer of performance of client care activities to specific members. So in your exam, assignment can be in this situation. Okay, which of the following, okay, will the nurse assign the care for a client, blah, 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 okay, immediate post-op? Is it number one, okay, a nurse floated in the unit? Number two, a nurse who just completed her orientation? Number three, okay, a nurse in the medical surgical facility, 10 years in service. Okay, so questions like that, all right, that is your assignment, all right? But take note in your prioritization, nurses. What do we mean by prioritization? So basically, prioritizing, okay, is deciding which need or problems requires immediate action. Okay, prioritizing is basically deciding, okay, which needs or which among of these clients in your option that requires immediate action, and which one could tolerate a delay in response until a later time because they are not urgent. So in your questions such as your prioritization, all of those options are actually correct. Okay, but you have to choose what is or which is the best answer, which is the best answer, okay, which among of these answers that requires immediate action. And sometimes your prioritization, this would now test all your concepts, okay, basically in your medical surgical nursing topic. What else? Okay, in your psychiatric, okay, questions or questions relating to your psychiatric nursing. So prioritization, these are classified as high, intermediate, or low. So take note of these guidelines for prioritization. So number one, clients' needs, okay, that are life-threatening or that could result to harm to a client if not treated or left unattended are the highest priority. Okay, life-threatening. So that means you're suicidal client or suicidal patient. All right, highest priority. Clients' needs that are life-threatening, okay, or that can result to harm to the client if not treated or left unattended. A depressed client, okay, 2 weeks after taking your MAR plan, the nurse noticed a sudden, okay, improvement in the client's mood. The client now greeted the patient, good morning. The client is able to take a bath. The client is able to participate in a group activity. Which of the following would alert the nurse? Okay, so questions like that. Because again, those clients with in 2 weeks course or 4 weeks course of their antidepressants, they would now show what? increase of their energy. And that increase of their energy, okay, is the best time for them, or this is, the time wherein they can really, harm themselves or execute or kill or do suicide, attempt suicide. Okay, suicidal clients, life threatening, or that could result in harm if not treated or left unattended. What else? Okay, the nurse can also use the principles of the ABC. Are you familiar with the principles of ABC? That is your attend to those clients with airway problem. If not, again, in the option, there's no airway problem or airway compromise, excuse me, breathing. Okay, the letter B. Okay, that is breathing. All right. If breathing and airway or airway and breathing is not in the option, then attend to those circulation problem. Okay, the ABCs. So in prioritization, if in the option, let's say you have this three in the option, which would you attend to first? Okay, your clients with airway compromise or airway problem. Yes, Soluchana. Yes, Soluchana.
Ma'am,
Uh-huh.
has the ABC changed into BAC, or is it still the ABC for the
BAC.
NCLEX?
Okay, BAC, I think that is, or not your BAC. That is your compression, airway, and breathing. That is when you do your CPR. But still, airway is your priority and not your breathing. Okay, airway compromise. That would be in cases such as what? Tracheal deviation. Okay, there is a shift to the left. Okay, your tracheal deviation, airway compromise, priority. All right, are we clear, nurses? Still, it did not change. Airway is still the priority. Okay,
Yes, ma'am.
airway. Okay. So if in the option you have in there, all right, the client is having shortness of breath. But here in the option, okay, the client is having tracheal deviation, airway compromise. All right. Or let's say in the option, so circulation, you see in there circulation. Okay, the client is already having compartment syndrome. Remember, in your circulation, these are your neurovascular compromise, neurovascular emergency. So you have to choose that one. Okay. But NCLEX will not give you, okay, everything in there that, again, in cases for your airway, breathing, and circulation, if it will be in your option, still you have to pick your airway. Okay. Airway is still your priority. Okay, airway is your priority over pain. All right, but they will not give you, okay, airway client, suicidal client. Okay, they will not give you that. All right, but hence they will just let you choose. Okay, all of those in the options are correct. Okay, but you have to choose the best answer. Okay, again, client needs related to maintaining a patent airway are always priority. Okay. Another, if cardiopulmonary resuscitation is necessary or your CPR, then the order is now CAB. If and only if the client requires cardiopulmonary resuscitation. So which do you prioritize first? Okay, the compression, airway, and breathing. All right. So nurses should identify, or if this client requires resuscitation, before you give your airway, okay, you have to do compression first, right? Compression. And make sure when you blow off, gone are the days that it's ready direct to mouth resuscitation. It's no longer mouth to mouth. But what is now in recent times would be there should be a this is what we call your uh, I have it, something that is a barrier that would, prevent from a direct contact of the mouth and the saliva of the patient, okay, for protection of the client, okay, and of course for the protection of the nurse. All right, airway and then the breathing. Compression, airway, and the breathing. Now, another principle or guideline is that you can also use the Maslow's hierarchy of needs theory. Maslow's hierarchy of needs theory. Okay, this is what your, sorry. Okay, priority would be is your physiologic needs, right? The food, the shelter. All right. Next would be the safety, love and belongingness, okay, self-esteem and self-actualization. So which among of these in your muscles hierarchy of needs that we have to prioritize? Of course, the physiologic needs. All right, such as what? Your food of the client. Okay, physiologic needs first. Then next we have your, okay, the nurse would also use the steps in the nursing process. So steps in your nursing process, your advice, your assessment first, okay? Then assessment should always be the priority. Assessment is always your priority. If in answering your NCLEX, that you you may not have that a good foundation of the concepts, all right, or if your lesson you're just quite somehow guessing, so these guidelines may help you, okay, but overall nurses, these are just guidelines for prioritization. What's more important is that you know the concepts, okay, you know the topics very well, because what if you have a good understanding of the topics, whatever the question will ask you, you would know how to answer the question appropriately. Okay, so assessment to prioritize, let's say for example in the option, you have their evaluation, you have their intervention, you have their assessment. Okay, again, answer would always be the assessment. Okay, assessment. And okay, so let's do practice questions. I have several practice questions here for your prioritization. So okay, the nurse assigns an unlicensed assistive personnel to assist a client with dysphagia and homonymous hemianopsia, which action made by the UAP requires immediate follow-up. Okay, the nurse assigned an unlicensed assistive personnel to assist a client with dysphagia and homonymous hemianopsia, which action made by the UAP requires immediate follow-up. Again, what is your homonymous hemianopsia? What is your homonymous hemianopsia? Anyone? Homonymous
Seeing
hemianopsia.
in one side, just one side of the,
Okay.
not being able to
Hemi,
see in one side.
okay. Hemianopsia, this would actually result to your client who is post-CVA, wherein half of the body is paralyzed. Okay, there is okay, plegia. So in your hemianopsia, okay, let's say the affectation in your head wherein it suffered stroke would be the right hemisphere. Affectation, okay, would be shown in the left hemisphere. Hemianopsia, left side of your eye is blind. All right, this cannot see. Homonymous hemianopsia, basically, this tells you that both of your eyes, left side, okay, are blind. It cannot see. Okay, that is your homonymous hemianopsia. All right, both of the eyes, okay, left-sided or right-sided, cannot see, or both, okay, of your eyes are half blind. So in the question, so which among of these action made by the UAP that requires an immediate follow-up? Okay, that would be your number.
Oh,
Number
Number 3.
Number 3, very good. Okay, the UAP offers clear liquid during meal. Remember, the client has dysphagia. Okay, so the client has difficulty in swallowing. So therefore, this client, if you give them clear liquid, then the more, okay, you put the client at risk for aspiration. All right. How about this one? The registered nurse RN delegates a task to the licensed practical nurse. If the LPN fails to perform the task within acceptable standards, which would happen? Select all that apply. Okay. Is it number one, a potential for nursing malpractice emerges? Number two, institution remains legally responsible for the situation. Number three, the accountability for care remains with the RN. Number four, the licensure of the LPN would be revoked. Number five, the accountability for care remains with the LPN. Answers would be okay. How about the others? Okay. So again, the registered nurse delegates a task to the LPN. If the LPN fails to perform the task within acceptable standards, what do you think happens? So these are what might happen, nurses. The license of the LPN will not be revoked. Okay, whose license would be revoked? The license of the RN. Because who delegates a task? That is RN. Who remains accountable? The RN. So the license of the LPN will not be revoked, but the license of the RN would be, okay, revoked. Now, take note, the institution remains legally responsible of the situation. Basically, the institution represents, okay, your workplace, okay, the hospital that you worked with. They are the ones who will pay to whatever, okay, the damage that has been done to the client. All right, they are the ones responsible for the situation. Your institution are the, okay, should protect you. They have the right to defend you. But in the event that the case is much stronger than the client, all right, so it is the, okay, um either the judge would, okay, let the case of the client win or the institution. All right. And of course, if the LPN fails to perform the task within the acceptable standards of care, then possibilities of malpractice. And again, the accountability of care remains within the nurse, the delegator. All right. Another question. The nurse is caring for a client on a neurosurgical unit, okay, a surgical floor. Which client should the nurse see first? All right. This is an example of your prioritization type of a question. So you are assigned to care in a neurosurgical floor. Which among of these clients would you see first? All right. Is it number one? Okay, the client diagnosed with epilepsy who reports over the intercom of a smell of a burnt wire. Number two, a client with a lumbar one spinal cord injury who complains of shortness of breath while jogging. Number three, a client who had a recent motor vehicular accident who is seeing spots at his visual fields. Number four, a client diagnosed with CBA who has resolving left hemisphere. Okay, what is wrong with option number two? What is wrong? Okay. Can a client with lumbar one spinal cord injury can do jogging? Yes or no?
Wish.
No, right? So
Doing
obviously
jogging.
number one or number two is wrong. Okay, number four. Would you go to this first? Is this urgent? Does this client need a high priority?
No,
No,
it's
right? Because the
resolving.
No,
client, all right,
it's
there's already a
stable.
resolving. Okay, how about number one? Okay, the client diagnosed with epilepsy who reports over the intercom a smell of a burnt wire. Okay, now take note, those clients with epilepsy, they undergo several phases, right? If
Yeah.
they would call, okay, they feel that they smell a burned wire, then they are already experiencing the oral phase
Oral.
or oral phase, meaning to say that they are about to have a seizure any minute. So the client is made aware by the nurse that when you experience this and that, you have to phone us in so that we would know, okay, right away. So definitely this is expected. Okay. So answer is number three. Good job. All right. Why? Why number three? Majority answered number three. Why Libby? Why
Yeah,
number
but
three, Jaspal?
seeing is
Why
good.
number three,
So,
Nidhi? Okay. Why number three, Richa? Why?
Head injury.
Okay. Head injury. Uh-huh. The client who had a recent motor vehicular accident who is seeing spots at his visual fields. This is already an indication of what? Retinal detachment. Please
detachment.
note in your retinal detachment, there is, okay, a separation of the retina to the choroids.
Sport.
So your choroids are the ones who supplies blood. Okay, there is detachment. And that visual fields or that spots in the visual fields, these are already bloods. Okay, so can this lead to blindness? Yes, definitely. Okay, if not, assess immediately. This is a life-threatening condition. Why? Because, okay, this can actually lead to blindness.
Sport leads
All
to,
right.
yeah.
How about this one? You should be most concerned about an order for total parenteral nutrition fat emulsion for a client with which condition? Is it number one, gastrointestinal obstruction? Number two, severe anorexia nervosa? Number three, chronic diarrhea and vomiting? Or number four, fractured femur? Number? Okay. All right. How about the others? Okay. Why number four? Why number four, Janine?
Because of fat embolism, that is they are at risk of fat embolism.
Okay, they are at risk for fat embolism. Okay, take note, fractured femur. There is already a release of fat globules in the bloodstream of the client. And here you are, the doctor, okay, ordered fat emulsion. Okay, the more you are increasing the possibilities or the risk of, okay, fat embolism. Okay, so fat emulsion should be used with caution. Okay, so although your client with severe anorexia would benefit from this one, but okay, fat embolism is still our priority here. Okay, the nurse cares for a client in the emergency department for clients presents complaining of side effects from prescribed medication. Which of the following clients should the nurse see first? Okay, how about the others? Okay, okay, number one. A client receiving clozapine or clozaril is experiencing flu-like symptoms, fever, sore throat, and lethargy. Number two, a client receiving valproic acid, depakine, and experiencing tremors. Number three, a client receiving lorazepam ativan is experiencing abdominal discomfort. Number four, a client receiving methylphenidate hydrochloric Ritalin who lost 5 pounds in 4 weeks. Okay. Answer is, okay, majority answer number two. A client receiving valproic acid, depakine, and experiencing tremor. Okay. Does this client requires immediate attention?
This is expected, I believe, side effect of valproic acid.
Okay. Tremors is expected in your valproic acid. Okay. Basically, those who are experiencing tremors, okay, and the client depakine is actually given to your clients with convulsion, right? These are anti-convulsant drugs. Okay. Now, although yes, okay, you can, but okay, aside from your depakine, client, okay, client number one, okay, that is receiving clozaril or your clozapine is your priority. Why? Okay, did we not give this last week in our psychopharmaco? Very good. Your agranulocytosis. The client is already experiencing flu-like symptoms. Okay, flu-like symptoms such as what? Fever, sore throat, and lethargy. So this is, okay, the client that you need to, okay, see first because this client is already experiencing agranulocytosis. Okay, this client is unstable. Are we clear? Okay. Anxiety, lorazepam, this is your anxiolytic drugs, right? Anxiolytic drugs. Is it benzodiazepine or your non-benzodiazepine?
It's a benzo.
Benzodiazepine, okay? Ritalin, this is for your clients with, okay, this is for your
ADH.
clients with
ADHD.
ADHD. Very
ADH.
good. Okay. How about this one? The nurse sees patients in the gastrointestinal clinic. Which of the following patients should the nurse see first? Mhm. Okay. How about the others? Okay, number four. Why number four, nurses? Okay, why number four? You guys are correct, but I just wanted to know why. Okay, why number four?
Increased ICP.
Pyrolic. Um.
A newborn. Okay, a newborn who is experiencing projectile vomiting and irritability. Why?
Pyrolic hypertrophy also.
Intestinal obstruction could be.
This could be an indication of what? Your pyloric
Pyloric stenosis.
stenosis. Very good. Okay.
Stenosis, yeah.
Pyloric stenosis meaning the pylorus sphincter fails to open. Okay, that, okay, whatever the milk that the newborn drinks, it just stays within the, okay, pyloric or in the esophageal area, okay, esophagus. All right, so pyloric stenosis, it fails to open. All right, so this indicates pyloric stenosis. Good job. And could this predispose the client for risk for fluid and electrolyte imbalance? Yes or no? Can this predispose the
Yes.
newborn?
Yes.
Yes, okay.
Yes,
Most
ma'am.
especially with
Yes.
the fluid imbalance. Remember, okay, your newborn is comprised of how many percent of fluid? 80%. So majority of the weight of the newborn is consists of fluid. So therefore, any episodes of projectile vomiting, any episodes of your diarrhea, in between of those choices, let's say an adult, okay, who had a lost bowel or diarrhea for 3 days, okay, a newborn or an elderly, okay, who has having vomiting, okay, and um, vomiting for 2 days, or your newborn, all right, experiencing diarrhea, okay, and vomiting for 2 days, still that is your priority. Why? Because again, all right, the weight of the newborn, okay, is consists about 80% of liquid or fluid. All right, so any projectile vomiting, okay, any episodes of diarrhea or loose bowel, this can actually predispose us or put them at risk for your dehydration. All right. Another, when planning the assignment of an LPN, which of these tasks would be appropriate? Okay. When planning the assignment of an LPN, which of these tasks would be appropriate? Is it number one, adding 40 MEq of potassium chloride to an infusion of 5% dextrose in water? Number two, monitoring an infusion of hyperalimentation that is infusing at 1000 ml per hour. Number three, flushing the port of catheter that is located in the subclavian area with normal saline. Number four, attaching an infusion of packed cells to the side part of the infusion of normal saline. Number,
2.
okay, good job. That is your number two. All right. So again, subclavian area, this is considered your central line. All right. Adding potassium chloride, okay, this is a high risk drugs that only an RN, okay, can be allowed. All right. Will you give potassium chloride IV push? Yes or no?
No.
No,
No.
because you're
No.
killing the patient or the
No.
client. Good job. Okay. How about this one? Which client's pain should be assessed initially? Which client's pain should be assessed initially? Oops, it already showed. I did not. Okay. So the client experiencing pain 2 hours after liver biopsy, that is expected. Okay. A client experiencing pain with long leg cast who was medicated for pain 45 minutes earlier. So this is already an indication of what? This is
Compa-
your compartment
Compartment
syndrome.
syndrome.
Okay. Take
Compartment
note, the client had
syndrome.
taken pain medication 45 minutes earlier.
Okay.
So at least by then, 45 minutes after drinking, the client should be relieved from pain. So therefore, okay, the client is unresponsive to the main medication. So definitely, this is already an indication of your compartment syndrome. All right, how about this one? After an explosion at the factory, one of the workers approached the nurse and says, I am an unlicensed assistive personnel at the local hospital. Which of these tasks should the nurse assign to this worker who wants to help during the care of the wounded workers?
One.
Get temperature. Number two, take blood pressure. Number three, palpate pulses. Or number four, check the Glasgow Coma Scale. Okay. Get temperature. Okay. Okay. Take note, go back to the questionnaire says, after an explosion, okay, after an explosion at the factory, okay, there is an explosion. To check effectively of who among of those casualties has been affected or not, or those with chances of survival, it is best that you assign the UAP to palpate the pulses of those casualties. Okay? Why? To check whether you're gonna attend to those, okay, with if those with no pulse anymore, just leave them. Okay? Who are those with chances of survival? Those whom, okay, upon palpation that you notice or feel pulse. Okay, are we clear? Clear, nurses?
Yes.
Okay, very good. How about this one? Okay, children from a school bus accidents are transferred to the hospital. The nurse performs triage in the emergency department. Which of the following patients should the nurse see first? Is it an 8-year-old with a superficial burn to the arm? Number two, a 7-year-old with a burns on the face. Number three, a 6-year-old with small laceration to the arms and legs. Number four, a 5-year-old complaining of elbow pain. Okay, number two.
Second.
Good job. Okay, why number two?
Airway.
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 Okay, why airway? What could possibly occur? Perhaps the client is able to inhale those smokes, right? Direct inhalation of the smoke, all right, causing destruction or
Laryngeal
damage
edema.
to the, okay, alveoli of the client and also your laryngeal edema. Good job. Okay. So any questions, nurses? Okay, any questions? Would you like to have an overview of your infection control? Because this will be discussed separately. Okay. Yes, please. Just an overview of your infection control. All right. So for the infection to be controlled, all right, for the infection to be controlled, you have to at least break the chain of infection. Okay, basically the chain of infection, this is just like, a cycle of as to why infection keeps spreading. Okay, this is a cycle. It always starts with what? The reservoir. What is your reservoir? This is basically where these infection, bacteria, viruses, houses. So who are those reservoir? That is your human, okay, us. We are the carrier of the virus, parasites, bacteria. Who else? Okay, the animals can be a reservoir, all right, or even the hospital equipments can be a reservoir of these bacteria. Okay, particularly your stethoscope, because your stethoscopes are used from one client to another, right? So if you did not clean your stethoscope, if you're not aware that there's already a bacteria in you that is housing, can that exit from you? Yes, definitely. Your portal of exit, this can be in a form of, for human being, the sputum, okay, the stool or the emesis, okay, or through sexual intercourse, unprotected sexual intercourse, okay, or even blood transfusion. Okay, so since it already exited in that, okay, reservoir from that human body with that bacteria, so can it be transmitted? Yes. All right, so mode of transmission, that would be through direct contact, okay, unprotected sexual contact, okay, or sexual intercourse. So here comes, okay, possibilities of your STI or your hepatitis C, right? Or it could be through airborne, okay, airborne. So these bacteria are just hanging in the air that is not visible, okay? We cannot see it. So we are unaware that the environment that you are in already has, bacterias or organisms or microorganisms that would cause you to possibly, okay, spread, let's say, for example, your tuberculosis. Okay, so portal of entry, yes, this is the time that these bacterias, okay, get into the person. Okay, and portal of entry, okay, that can be if, number one, you have a low immune system. Okay, low immune response. So who are those clients with low immune response? Who are those clients? Clients who are, okay,
Chemotherapy patients.
chemotherapy client. Okay, those who are receiving chemotherapy clients, they are immunocompromised clients. Okay, those clients who are, what else?
Steroids.
Okay,
Long-term
under
Those who
steroids.
have
long-term use of your corticosteroids. Okay, they are immunocompromised clients. Okay, who else?
Organ
those who
res-
have
organ
autoimmune disease.
Neutropenia.
Okay, those
Neutropenic clients.
clients, okay, with, I heard it earlier,
Autoimmune disease.
Organ transplant.
Autoimmune diseases.
organ transplant, okay, ready to receive, okay, the recipient of your organ transplantation. They are immunocompromised clients. Okay, those who are autoimmune client, autoimmune. Okay, who else? Those
Yes.
clients under neutropenic precaution, right? Who are those clients under your neutropenic precaution? Okay, how about your HIV client?
HIV patients.
Okay, very good. Your HIV patients, because basically they have a weak immune system. All right, who else? Okay, what else could be a portal of entry? Those with, okay, skin breakdown. Remember, okay, your skin, okay, your intact skin, this is our number one line of defense against microorganism, right? So if any or in event of skin breakdown, okay, or break in the membrane, all right, portal of entry,
Extreme prematures.
right?
Extreme
So
premature
again,
babies.
right, bed sores, right? So, and once it enters, then you'd become a susceptible host. Okay, so susceptible host, organ transplant client, leukemia, those clients with AIDS, those we mentioned earlier. And that susceptible host is now the new reservoir. Okay, so it would continuously spread, okay, because of these, okay, what we call the chain of infection. Now, for it to stop, okay, for it to stop, then basically you have to break the chain of infection. So breaking the chain of infection, if the client is neutropenic under neutropenia, so when the visitor comes in, as much as possible, okay, you avoid bringing flowers, fresh flowers, right? Or when you serve the food, it should be well cooked food. This susceptible host should not be in the crowded places, okay? Or if you notice something that your reservoir, the human being, okay, you already experienced some slight fever, you were advised by the doctor to take the medication, the antibiotic in full course for 7 days, okay, you did not took it, or you are self-medicating antibiotic, then definitely that cannot eradicate the bacteria inside of you, right? Portal of exit, nurses, okay? You did not properly handle, all right, these sputum, these feces, these bowels, okay? You did not use any protective barriers when you go, having sex with strangers, all right? Mode of transmission, okay, you did not use your personal protective equipment, your PPEs, right? So definitely any break in the chain of infection would stop the spread of your infection, right? So aside from that, nurses, okay, in order for us to stop the infection, okay, we have this what we call your medical asepsis and your surgical asepsis. Basically, your medical asepsis, these are Okay, a method for us to reduce the number of pathogens. Okay, these are the routine and medical nursing procedures, such as what? Your hand washing, hand hygiene, donning or wearing of gloves or use of gown. Okay, the process of disinfection or hence, okay, more of your clean technique. All right. Surgical asepsis, these are, okay, destroying all the pathogens, okay, including the smallest spores. Okay, this is more applicable to your, okay, operation or operative procedure wherein we autoclave these equipments that we use. All right, prior to the surgery, the doctors and the nurses should do meticulous hand washing, scrubbing, okay, use of sterile gloves and gown. All right, you cannot wear your outside clothes into that operating room. Okay, now you sterilize these equipments, the gowns, all right? You use Lysol, betadine, all right? You autoclave, ethylene oxide used for intubation supplies, or basically your surgical asepsis. This is also known as your sterile technique. All right, sterile technique. So sterile technique when you do or assist the doctors in surgical procedure. When you do wound care, okay, when you do wound care, you can just apply your, okay, clean techniques. All right. So in stopping the spread of infection, so you have to make sure that you have to follow, okay, we actually have two tiers, the first tier and the, okay, first tier would be the standard precaution and the second tier would be your contact based precaution. First tier standard precaution, basically this applies to all clients, okay, used for all clients regardless of the diagnosis. When most especially there is a contact with blood, um, body fluids, secretions of the clients, all right, excretions, non-intact skin, and mucous membrane. So basically, according to CDC or your CDC, anyone that you should be in contact with these clients should wear at, these PPEs, the gowns, the gloves, the mask, and the goggles. All right. Most especially, you do not know the condition of the client. If you're not sure that the client may have a communicable disease, then you should maintain your standard precaution. All right, used for all clients regardless of the diagnosis, most especially when there is a contact with blood, gowns, body fluids, secretions, excretions, okay, non-intact skin, and mucous membrane. So we are required nurses, okay, or anyone in the medical team to wear gloves, mask, and goggles. So nursing considerations, okay, discard all contaminated items, okay, with blood or body fluids, secretions. Where do we discard it? In a biohazard. Okay, now when you remove your PPE, it should be removed appropriately. All right, so the donning and doffing of your PPE, um, it will be discussed hopefully in your next topic, which is your safety and infection control. All right. Use a what? This is what I called earlier, a ventilation device when you do a mouth-to-mouth resuscitation. Gone are the days that when you do mouth-to-mouth resuscitation, it is direct. Okay. Now we would use a ventilation device. All right. And make sure that when you use a needle, right, the used needle should be disposed where? In a punctured, resistant container. And would you recap these used needles? Yes or no?
No.
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 Oh, very good. Okay. Never recap your used needles. Okay. Why? There are a lot of cases of what? There are a lot of cases of your needle stick injury.
Needle prick.
Now, what if, okay, what if you accidentally pricked, okay, your thumb? So in cases of your needle stick injury, what are you gonna do? Okay, just remember the wrap. Okay, wrap in cases of your needle stick injury. What are you gonna wrap? Okay, wrap. Okay, basically this is just a mnemonic. Okay, first you have to wash your hands. Okay, P or the R, report rather to the supervisor immediately. All right. A, you have to assess, okay, the blood of the client, okay, and the nurse, and letter P, the prophylaxis. All right. Remember, wrap in cases of your needle stick injury. Okay. Are we clear, nurses? Any questions? Now, I just wanted to share this to you, the steps in donning and doffing of your personal protective equipment. Okay, when we say donning, this is wearing. Okay, the letter O-N, on. Put on your personal protective equipment. Okay, put on. Putting on. Doffing, okay, this is removing. Okay, putting off your PPE. Remember, okay, in your nursing considerations of your standard precaution, okay, you have to doff off, okay, or remove the PPE appropriately. And at the same time, you have to wear it appropriately as well. So in donning your PPE, first you have to wear your gown. Okay, next would be the mask. Next would be the goggles. And last but not the least would be your gloves. In donning, in putting on, you have to wear your gown, mask, goggles, and your gloves. All right. Gloves should be the last one. Okay. Doffing, okay, doffing or putting off, removing off those personal protective equipment, you have to remove the dirtiest first. Okay, we have to remove the dirtiest that comes in contact with the client first. That would be remove the gloves first. Okay, next would be after you remove the gloves, okay, you remove your eyepiece, okay, which is what? Your goggles. All right, after you remove your goggles, you have to remove your robe or your, okay, gown. All right, and last, you have to remove the mask. Okay, remove the mask, okay, when you leave the room of the client, or if there is a washing facility inside the room of the client, okay, before you remove the mask, okay, you can do hand washing. But in some cases, doffing off, okay, removing the personal protective equipment, you remove the gloves first. Next would be your, okay, eyepiece or your goggles. Next would be your robe or your gown. Okay, last would be your mask. And then you do your hand washing. Okay, so think of in your doffing, you are removing the germ. Okay, you are removing the germ. Okay, you are removing the germ. G for your gloves. E, okay, for your eyepiece. Okay, sorry. R for the robe, or that would be your gown. Okay, and then the mask. Okay, remove the germ. All right, remove the germs. So your gloves has a lot of germs in it, so you have to remove their gloves first. Next would be the goggles. Next would be the gown, and then the last but not the least, your mask. Okay, so okay, again, donning and doffing. This will be asked as sometimes in which of the appropriate order, okay, are you gonna, okay, do when you are wearing or you are doffing. All right, so let's try to answer this one. Which of these correct order of events, okay, a nurse should follow when applying personal protective equipment, PPE? When applying, Okay, majority answered number 3. Good job. Okay, that is your number 3. All right, so hand washing first, and then the gown, the mask, the eye protection, and the gloves. Okay, how about this one? A nurse manager is receiving, okay, the principles of surgical asepsis with the nursing staff. The nurse manager tells the staff that it is necessary to use the principle of surgical asepsis in which situation? Okay, surgical asepsis. Okay, surgical asepsis, sterile technique. Okay, sterile technique. Okay. Select all that apply. Okay. Surgical asepsis or your sterile technique. Okay. Removing a dressing. Okay. Removing. Okay. You were asked here unnecessary rather. Okay. Not necessarily that you will do or you will apply the principle of your surgical asepsis. Okay. Unnecessary. A nurse manager is reviewing the principles of surgical asepsis with the nursing staff. The nurse manager tells the staff that it is unnecessary to use the principle of surgical asepsis in which situation. Okay, removing dressing, a wound dressing. Remember, I told you earlier, this is more of your medical. Is it surgical? It's unnecessary, right? Reapplying the sterile dressing. Okay. Inserting intravenous line. This is more of your, all right, surgical, sterile.
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 Inserting a urinary Foley catheter. Is this medical or
Sterile.
sterile?
Sterile.
Okay.
Sterile.
Suctioning
Sterile.
a tracheobronchial airway. Suctioning. Suctioning.
Sterile.
Sterile. Okay.
Sterile.
Caring for immunocompromised client.
Sterile.
Okay.
Sterile.
Medical asepsis.
Medical.
Okay.
No. Tertiary.
Unnecessary. All right.
Okay.
Answers are 1 and 6. Okay. So I'm afraid we no longer have time, nurses. Okay. So I hope I'd be able to still meet you some other time. And that is just an overview of your safety and infection control. I believe it will be discussed on the next topic with you guys. All right. So thank you so much for attending today. And I hope you learned something. Okay. Any questions you have for me, nurses? Any questions?
I want to ask about patterning the law in Australia. For
Okay.
NCLEX, does it just matter for you? You just have to focus on the law in the United States, or do you
Okay.
have to focus on
Okay.
Australia?
Laws in Australia that we have to ask, okay, the coordinator. Definitely, we will incorporate that as well. Okay, if it does not have any difference from what we have discussed, okay, because
Mm-hmm.
again, your NCSBN, these are the ones who create the questions, and it's gonna be the same questions as well. All right.
Okay, so the NCLEX in US, like pertaining to the law, ethics and law legal rights,
The
is
principles,
the
the
same
ethical
thing with
principles of
the.
nursing, it's all the same. All right. Ethical
Okay.
principles of nursing, your autonomy, the non-maleficence, it's basically the same, regardless of where you are.
Okay.
All right. Okay. So any
Thank you.
questions, nurses? Okay. So good night, everyone. Thank you so much for coming.